So now we're gonna go for the ONCO map. Okay, the ONCO map is, let me explain a bit what's the difference between whole exome sequencing and targeted sequencing. So the first thing that we talked about was whole exome. So we're sequencing every single exonic area that might be there in the DNA. However, with the specific targeted sequencing, like OncoMap, for example, we're sequencing specific genes that are related to the oncology in that case, and we can see the genes in front of us. So in OncoMap, we're looking at the genes. We're not looking at the full exome because the clinical picture that we have for this patient, for example, it is very much specific for oncology. So if we can see the clinical information on the left-hand side, we can see that it is a 60-year-old female that was diagnosed with ovarian cancer, and her aunt was diagnosed with colon cancer at age of 55. So in this specific case, we see that cancer has been there and the family history has been there as well for the disease. We can see that the data quality passed, okay, and the sample quality passed as well, because the data quality is often different from the sample quality. There are multiple quality steps that we do before we do the sequencing to make sure that the result that we're giving the patient are reliable result. Then we can see what are the tests that or what are the genes that we looked at. So here we looked at an example of BRCA1, BRCA2, TP53, etc. And these are the specific genes that we had looked at. Then after that, we see the detected variants. We see no pathogenic or likely pathogenic variants detected, which is very important. It's all because often we always think that cancer is hereditary, and not that's not always the case, because there are epigenetics that are involved as well. There are stress factors that are involved, and there is environment that comes in the middle of all of this and could alter our DNA and cause mutations to our DNA. So here, the genetic interpretation that was given is what I've exactly explained, is that 1 in 3 people with are known, or the stats right now says that 1 in 3 people will get cancer in their lifetime. However, it is multifactorial, meaning that environment has an effect, stress has an effect, the type of food that we eat has an effect, the air that we're breathing, etc. So the environmental factors is very important in that case, even though that she didn't have any pathogenic or likely pathogenic variant that was detected. But here it gives you recommendation that even though we didn't see any kind of pathogenic variants that were detected, it is very important that we do broader tests that are specific to colon, for example, to make sure whether this person has any variants that are altered related to colon cancer or not. So we can see here that it says in this case, Miss X tested negative for any meaningful exonic variants in all of the above genes. However, it is also important to point out that families share genetics as well as habits and environment. So if they are living in the same habits and they are living in the same environments, most probably they are exposed to the same stressors and toxicity, and it could be that her genes are altered for colon cancer specifically. So it also gives an understanding for the patient that even if their SNV, there is a specific test single nucleotide variant that was detected, it doesn't mean necessarily that this patient is going to get cancer or not. Because again, the fact that we have an alteration or mutation in the gene, it doesn't mean that this person will get cancer in their lifetime. They could change their lifestyle. They could have a better lifestyle that would prevent and we could take preventative measures to prevent cancer from happening. And that's also a part that is very important that we explain to our patients, because patients think there are a lot of patients that do not want to do ONCO map, or they do not want to do whole exome. They don't want to discover what is there in their DNA, but actually discovering what's there in their DNA give them an advantage to understand what is the lifestyle that they should follow, what are the habits that they should change to prevent something from this from happening. Then here we have the recommendation that we should do some sort of a genetic testing that looks at the CNV, because CNVs are not detected with targeted sequencing, which is in this case is the targeted sequencing, and then it says that we should do MLPA testing for BRCA1 and BRCA2. And follow up with the physician, of course, genetic counseling for sure, and then continued management and surveillance for her cancer as deemed appropriate, which is obvious for sure. And that's it for the OncoMap.